Sleep without your bladder waking you up. Stop frequent urination at night, or also known as Nocturia. You might be one of those who often think, why do I pee so much at night or feel so fatigued even after waking up? If so, watch the complete video to learn why it happens and how to prevent it with simple and small changes in your diet and routine. Okay, so waking up once or twice isn't usually a warning sign, but anything beyond that is certainly something you should be worried about. Frequent midnight urination is called Nocturia. It affects both men and women equally. There can be a lot of factors behind Nocturia, such as health issues, medications, diet, and lifestyle. Naturally, your body produces less but concentrated urine during your sleep time, which means that you usually should be sleeping 6 to 8 hours uninterrupted. And if you've taken fluids right before bedtime still, there shouldn't be a need for urination more than twice a night. Nocturia is a normal health issue among elders, but it can happen at any age. It can be extremely distressing and requires medical treatment, but before that, you need to figure out why you're experiencing this issue. Nocturia affects more than 50% of people aged over 50. Aging is the main triggering factor. As you get older, your body's ability to concentrate urine decreases, leading to more frequent trips to the bathroom. Nocturia is likely to affect 1 in 3 people of age above 30. The symptoms of nocturia include waking up twice or more to urinate at night, fatigue, poor sleep quality, tired after waking up, and urinating more in volume than normal. If you're polyuria means peeing too much in millimeters, but not necessarily too many times during your sleep cycle. First things first, let me give you a detail about how it affects your quality of life. The impact of nocturia cannot be overstated and overlooked. At the ground level, it disrupts your sleep pattern. This continuous cycle of interrupted sleep results in daytime fatigue, irritability, and difficulty in concentrating. In severe cases, it may even lead to the risk of accidents and falls, particularly among the elderly. Further, chronic sleep disruptions cause more serious health problems, including cardiovascular issues, obesity, and depression. The constant lack of restorative sleep can strain your relationships, hinder productivity at work, and negatively impact the overall quality of your life. And that is just the tip of the iceberg, because a proper night's sleep is what keeps us going and doing the things that we're supposed to do properly and effectively. Without that, one's life comes to a standstill. Some anatomical differences between the sexes lead to nocturia, such as men with enlarged prostate pee frequently during the night due to pressed bladder. Similarly, women with pelvic organ prolapse, menopause, and childbirth are at a higher risk of developing nocturia, which is again gender specific. But other causes such as medical conditions and lifestyle choices are generalized. An overactive bladder is another culprit. It's when the bladder muscles contract more often than needed. More bladder contraction means a more sudden urge to pee no matter the volume of the urine. A combination of factors can lead to an overactive bladder, such as hormonal fluctuations, some medications such as diuretics and sedatives, excessive fluid intake, and constipation. Some neurological conditions such as multiple sclerosis, Parkinson's disease, or stroke can disrupt the signals between your brain and the bladder. This results in the bladder contracting involuntarily. Additionally, bladder infections in the urinary tract or bladder stones can irritate the bladder, leading to overactivity and urgency. Interstitial cystitis, or IC, also known as bladder pain syndrome or BPS, is a chronic and often crippling health condition. It mainly affects your bladder. IC is characterized by inflammation of the bladder wall that leads to a range of urinary symptoms. The major signs are frequent urination or nocturia, urgency, and pelvic pain. IC can significantly impact your quality of life. It causes physical discomfort and emotional distress. One research suggests that patients with IC may have defects in the protective lining of the bladder called urothelium. This is the main reason for irritation and inflammation when urine comes into contact with the inner bladder tissue. Well, this condition needs immediate medical care to treat the underlying cause of nocturia. Another reason is sleep apnea. It's a sleep disorder known for repeated interruptions in breathing during sleep. These interruptions, called apneas, are due to the relaxation of throat muscles or a blocked airway. Sleep apnea disrupts your sleep patterns by causing frequent awakenings throughout the night to resume normal breathing. These awakenings sometimes trigger a need to urinate. Moreover, the physiological stress of sleep apnea increases blood pressure and heart rate. Both situations stimulate the production of urine and urgency. Sleep apnea patients are more prone to develop conditions like diabetes or obesity, which can independently contribute to nocturia. Diabetes causes nocturia by increasing urine production. This happens primarily due to your spiked blood sugar levels. In diabetes, your body's inability to regulate glucose effectively leads to excessive thirst, so your fluid intake increases automatically. As your kidneys strive to filter and eliminate excessive sugar from the bloodstream, they produce more urine. This frequent urination often persists into the night, resulting in nocturia. Further, diabetes-related nerve damage also affects your bladder's ability to store urine properly. This impaired function signals the need to empty it frequently during the nighttime. Anyway, diabetes is a serious health issue and undoubtedly brings other medical conditions as a side product. To prevent them, you need to effectively manage your blood sugar level. Now that's where the main point of this whole video starts. Though evening or night snacking, high insulin, and nocturia aren't a one-size-fits-all scenario. If you do not have any other medical condition that is causing nocturia, you must look into your diet and eating habits. High insulin doesn't necessarily mean that you are diabetic. Normally, when you eat or glucose enters your blood after carbohydrates are broken down in GIT, it works like a stimulation to release insulin as insulin takes this glucose out of your bloodstream and into the cells. This suggests that more glucose means more insulin released from the beta cells of your pancreas. The relationship between insulin and your urine production is based on the hormone's role in regulating your kidney function. Insulin acts as a vasodilator. It increases blood flow to the kidneys. When insulin is high, your kidneys filter more blood, resulting in increased urine production. This theory is more relevant at night when insulin sensitivity is higher, especially if you're insulin resistant. So, high insulin levels induced by late night snacking can lead to more frequent nocturnal urination episodes. Now, this condition also varies. It depends on the types of snacks you consume. Snacks that are rich in sugar and simple carbohydrates not only trigger insulin spikes, but also increase fluid intake as your body tries to dilute the extra sugar. This increased fluid intake sets the stage for nocturnal trips to the bathroom. A study gives a clue to support this idea. When more insulin is released, it inhibits the release of some adrenal hormones that hold the urine. When there's more insulin, there's more suppression of the hormones and more urge to urinate. Another study on dogs indicates the same. When the dogs were injected with more insulin, there was a significant urine output noticed. But keep in mind that a high level of insulin is the underlying cause of many other health issues, such as it begins with insulin resistance, and insulin resistance goes a long way. It does a dramatic damage. It lays the base for pre-diabetes, hypertension, discoloration in the lower part of the legs, edema, dark spots on the legs, constant fatigue, especially after meals, enlarged gut, and other metabolic syndromes. So high insulin is one of the main reasons why you need to pee more than twice a night and why you cannot sleep properly and wake up fresh or fully energetic. However, factors such as age, metabolic health, and the timing and composition of late-night snacks all play a role in determining the extent in which snacking aggravates nocturia. Nevertheless, understanding this connection highlights the importance of dietary choices and their potential impact on sleep quality and overall health. So what do you do to avoid nocturia and lessen the frequency of urination, urge, at night. It's very simple. You need to make some quick changes to your diet and health routine consistently for a couple of weeks and observe a positive sign in your health. Initially, you can start slow and make progress over time for a long and lasting impact. Okay, so you need to stop snacking at midnight and even in the evening, be it a high or low carb snack. Go for dinner around 8 p.m. and ideally not after 6:30 p.m. Then avoiding anything edible can aid in digestion and minimize the risk of nocturnal bathroom visits. Also, stop drinking water and taking any fluids, especially soft drinks and alcohol, 4 to 5 hours before bedtime. You need to be mindful of what you eat during the day as well. Try switching to a low-carb diet, preferably a ketogenic diet, to have good quality sleep and reduce insulin secretion. Plus, monitoring your blood sugar levels, especially if you are at risk of insulin resistance or diabetes, is crucial. Good sleep hygiene practices also minimize the effects of nocturia on sleep quality. Creating a sleep-friendly environment, maintaining a regular sleep schedule, and implementing relaxation techniques can all improve the overall sleep experience. It helps you to cope better with disruptions caused by nighttime urination. That's all for today. Just try practicing these things and you'll start noticing changes sooner than you're expecting. Till next time, goodbye and sleep tight.